Samastangu more namaskar. In today's health discussion, we will be discussing a very common symptoms which people take very lightly, but in the long run, it causes a very bad situation. Say for example, headache. We take it very lightly. Headache, headache तो होची ताकू हमें बट paracetamol tablet खाई देला तो relief हो जाए. किस समय बता? For again it appears. But there are so many causes for headache. So another topic like backache. Backache अंटा बता तो समझते हैं होता है. सब लोग सोचते हैं कि हाँ कमर के दर्द है, हाँ थोड़ा देर शायद हम लोग कुछ ज़्यादा काम कर लिए, ये कुछ एग्जर्शन हो गए, फिर लेट जाते हैं, कभी ठीक हो जाता है. But in the long run, things go out of control. At that time, we need the help of doctors. So, from the beginning, if we consult with the doctors, things do not go bad and we get a lot of relief. To discuss this problem of backache, we have an eminent neurosurgeon, Dr. Amit Jaiswal is with us. He is a consultant from AMRI Hospital, Bhubaneswar. Dr. Jaiswal is a man of Rourkela. He is born and brought up in this city, and afterwards he studied in Cuttack and went on to do his neurosurgery, MCH in neurosurgery. And we are happy to have him here in Rourkela with us to discuss about simple problems like backache. I welcome Dr. Jaiswal to this health file. To start with, what do you mean by backache? Exactly, people say backache. Back starts from neck to the end of lower persons. Where exactly the pain starts? What is backache?
Exactly. Normally, हमें सबू back problems को उड़े waste basket term दे दो कि back pain हो जी. But actually, back pain normally what people refer to is low back pain. Okay. And low back pain refers to an area of spine. Ontaro a portion ta जोटा को lumbar spine को जाए. Lumbosacral spine. पूरा spine टा चारि भाग रे divide ही छी. Cervical मने बेको area, पिट्ठी मने dorsal, and ता तले हैला lumbar and sacral. जोटा low back को comprise करे. So low back एक मने lumbosacral area of pain.
Joint pain.
Correct. Lumbosacral area pain. It can be bone pain, musculoskeletal pain, or nerve pain. Right. So any pain in this area will be considered as a term called back pain, a vague term.
If it is upper at the upper level, say
yes,
upper
it's called as an upper back or upper thoracic or a cervical.
Suppose the person is having the pain in the neck. Is
yes,
that
so
called
neck pain?
Is the neck.
Neck pain.
But
the
back pain means it is the lower back.
Lower back.
Causes back pain.
Correct.
What are the causes for that?
Normally, first and foremost, as you said, it has become very common nowadays. Every other person is suffering from a mechanical back pain because of our sedentary life, lack of workout or healthy habits. We always have a lot of stress and strain. Sitting posture, sleeping posture, everything comprises a strain to the mechanical joints in the lumbosacral area. So that ultimately leads to degeneration and early degeneration. एगुड़ा शीघ्र खराब हवा start है जाए, and that is how a patient मानो को back pain करेगा start हुए.
How is the obesity related to this?
It's very important to that obesity has a very important role to play, because as you would see in pregnant ladies, the lordosis of the spine increases. माने onta curvature टा change है जाए. जेमती a pregnant lady, सेमती a obesity रे जो दी truncal obesity अच्छी. That means there is a loss, there is lot of load on the lower back, and that degenerates the spine very fast, and that is how this problem starts.
इटा commonly को एज रे बेसी देखिया को मिले बैक पेन जो कौन थी
जनरली आगरू इटा को गोटे एजेड एज ग्रुप रो प्रॉब्लम को जाउतला, बट नाउ इट इज very commonly seen in the younger age groups, and specifically in what you call as the IT people. That means those who have a desk job, बसी की long term बसी की कामो करिबा, these are the group of people, those who suffer from back pain and neck pain very commonly.
And sedentary life.
Sedentary
exercise
life.
करनांती, sitting
But
job.
sitting job रे अछंती.
Basically, those who do not walk for a long time.
Exactly. Those who are not
Okay.
actually taking care of their back and weight.
What about the pain in, I mean, the backache in the older people? What are the causes?
Similarly, as I said, a major issue is degenerative spine problem. Mane, with degeneration, these changes happen, like intervertebral disc problem, like there is listhesis problem. All these is basically degenerative. There is another thing which is caused by trauma. माने पड़ी गला परे जेमती हाथ फ्रैक्चर हो जाए कि गोड़ फ्रैक्चर है सेमती अंटा रे भी फ्रैक्चर्स ही परे. So degenerative, trauma, then there is neoplastic and infective. माने tumors ही परे, infection ही परे. Most commonly जेमती TB अंटा की बेको हाड़ोरो TB ही गला. Seta can cause this symptom. So as you said very correctly, we should not neglect any chronic back pain or very acute back pain. Jodi achi, then we should really consult a specialist and start the treatment.
Ajay, can this back pain happen because of any lack of, calcium, say for
yes,
any
very
food
correct.
Material or any deficiency
in the calcium or minerals. Yes, you are correct. Like calcium, like in other bones, calcium is very important. In osteoporosis is a condition which softens the bone. Mane onta hado guda soft heijibo ki ticket trivial fall rebi they will have a fracture. So those group of patients who are osteoporotic, mane females, postmenopausal age group, and there are other patients who are under chemotherapies or those conditions, people have soft bones, mane osteoporotic bones. So semane adhika chance thae tanku develop kariba fractures and backache.
এই लो बैकएक क्रोनिक जो लो बैकएक है ये लोग मानकर बहुत दिन धर की रहुची जो प्रॉब्लम रहती माने हाउ इट शुड बी डेल्ट विथ.
Actually it should start from the early age. माने starting रोही as a person I would just want to tell everybody that everybody should be very particular in taking care of their back. आजी जदि आजी to start करिबा then we will ensure our future also. माने health को देखिबा माने diet, then food habits, तांकर weight, exercises. Like nowadays people are doing yoga. Yoga is very beneficial in terms of making your back strengthen and your core strengthen. So muscles गुड़ा को strong रखिबा केवल exercises रे ही होबो and weight टाको control करिबा. The way you sit, normally हमें nobody teaches us के जानी नु exactly केमतिया बसिबा कथा केते prolonged sitting रे chair position टा केमतिया होबो, हाथ position केमतिया होबो, laptop रे. These are certain ergonomic things which in every corporate house or in every public sector place they should do small workshops to actually train everybody to prevent all these problems.
Okay, आउ जरे पचारे भी आपण को कि जो माने sleeping रहुची ये posture, the bed should be like hard bed हवा दरकार कि soft mattress जो use कर. Correct. Does it have any effect on the back?
It does have, and the way you sleep also does have. So हमें normally जो बहुत soft mattress समस्तों को कहूँ it is you should avoid it. Semi rigid mattress is the best. बहुत hard नहीं कि बहुत soft नहीं. जो गुड़ा usually बहुत soft था सेटा long term रे problem कराए उनटा को. And the way you sleep also is important. The best way to sleep which has the least pressure on the spine is जेंतिया छुआ मने सोंती side है की हाथ एठी थिबो और गोड़ो बंके की. So you should sleep in a fetal position. That's the best way to relax the spine. Any other position will have some strain in the spine. And when it comes to taking care of your neck, when you sleep, the pillow should not be, you should not take thick pillows, you should take only thin pillows. माने पतला तकिया यूज करिया कथा और बेको को से हिसाब रे मैनेज करिया कथा so that neck pain जेमतिया न हो.
Suppose a person is having severe backache.
Correct.
What he should do or what he should not do?
Yeah. Once if that person starts having back pain, then definitely he will immediately ask somebody and start taking some medicines. This is a normal scenario. And over the top counters, paracetamol or any other painkillers, he will start. But if with normal routine painkillers also, this pain is not subsiding, he should immediately consult a spine specialist. And that means not directly go to a physiotherapist and start the treatment. This is a very wrong thing which normally people do. They directly first go to the physiotherapist without actually consulting a specialist.
Right.
So first you consult the specialist, let him have a look, he will examine you, and if he feels that everything is all right and you don't require any further test, then he can advise you for physiotherapy. And later on you can consult and follow him up. But if he feels that you have some problem and advises you for certain tests, please do it, because the early you pick up these problems, the better it can be treated in an initial stage.
At the time of the severe backache, whether he should go for any exercise or it's banned?
In severe back pain, definitely initial thing is to keep the spine in rest so that the spasm goes out, and then that is a role where
should relax.
some form of physiotherapy helps, and drugs and other forms of intervention helps. And slowly once the pain goes back, you start your core strengthening exercises. So that is again a course of physiotherapy that has been given. And if your MRI is a test which is done to see diagnose spinal problems after doing an X-ray. So once these tests are normal, you can be leading a very healthy life and you can practice certain exercises throughout your life. You have to do that throughout your life.
Does yoga have any effect?
It has definitely has very beneficial effect, because it strengthens all the muscles, all the core muscles. It helps to make it more flexible. So all your joints and muscles become very flexible.
Okay. Do people need any kind of surgery at any point of time?
Yes, of course. As I said, spinal problems can be degenerative problems, neoplastic or infective. And similarly, all these problems can be managed. There are certain problems which can be managed with medicines, and there are certain problems which require surgery.
Okay.
So now surgical treatment has really evolved, and the results have started become very good, and that is why a lot of patients are getting benefit out of this also.
Okay. Thank you, Dr. Jaiswal, for
My pleasure.
Sharing all your experience with the people of Rourkela.
Thank you so
for
very
coming
much, sir.
here. So viewers, I hope you learned a little bit from our guest speaker, Dr. Jaiswal, and hope you will be able to do something for yourself. Thank you all.